In this video, we would explain how Maddy's experience in hospital led to an extensive NHS training programme on sepsis and acute deterioration. Maddy Lawrence was a bright, loving and athletic student who found her home playing rugby for her university team. During one match, she dislocated her hip and had to be taken to hospital in an ambulance for treatment.
While in hospital, Maddy developed sepsis, which is a life-threatening condition that arises when the body's response to an infection goes into overdrive. Despite a courageous battle in the hospital, Maddy sadly died from sepsis just weeks after her injury. She passed away here at Southmead Hospital in 2022 at the age of 20.
In response to Maddy's case, North Bristol NHS Trust developed and implemented an extensive internal training programme on sepsis and recognising and responding to deteriorating patients. The programme has already reached over 4,000 clinical staff and will impact on the care of tens of thousands of patients. As well as supporting young women to get into rugby, Maddy leaves a legacy that will help both families and healthcare workers to be informed on sepsis symptoms and save lives.
Sepsis kills more than 40,000 people a year in the UK. It is a life-threatening condition. It's caused by the body's immune system overreacting to a severe infection and damaging its own organs in the process. Some people are at higher risk of developing sepsis: the elderly, the very young, pregnant women and those with underlying health conditions. However, it can affect anyone, even young, fit rugby players like Maddy. Sepsis can complicate any infection. Common causes include chest or bladder infections. In Maddy, it developed from a rare infection of the muscle tissue around her dislocated hip.
Common early signs of sepsis. Sepsis can spread rapidly and early symptoms can be non-specific, so it's important to be vigilant. There is no single symptom that identifies sepsis. The symptoms include high temperatures, severe pain, shortness of breath, and mental confusion. People can also have slurred speech, extreme shivering, difficulty passing urine, or a rash or mottled skin.
Hospitals in the United Kingdom have guidance on the management of sepsis. This guidance includes the use of scoring systems, for example, the National Early Warning Score or NEWS. These scoring systems allow the early identification of the deteriorating or acutely unwell patient. Use of these scoring systems can improve outcomes in sepsis.
For Maddy, her signs of deterioration were not recognised early enough. This made it clear that more training for healthcare professionals on symptoms, monitoring systems and responding to family concerns was essential. Maddy had an emergency operation to fix her dislocated hip and was expected to have a swift recovery. After surgery, she initially seemed to respond well, but within a few days, she started to display signs of deterioration. She was also in extreme pain, to a level that was out of character for her. Her family were really worried because she didn't seem like herself. Sepsis was not at the forefront of her medical team's mind. She was a young, fit person with no wound at the time of dislocation and a closed repair at operation. The team looking after Maddy were falsely reassured by her young age and did not consider there were other causes to her deterioration which needed immediate action. 4 days after her operation, sepsis was identified, but Maddy was already critically ill. She was urgently admitted to the intensive care unit for emergency surgery and was placed on life support. Maddy spent the next 10 days in intensive care, fighting to survive and needing multiple operations. However, it was too late, and despite being very strong, she was not able to survive.
In response to Maddy's case, we have developed a dedicated training programme on sepsis and acute deterioration, using Maddy's story to highlight that young, fit and healthy people can get sepsis too. Our new sepsis guidelines emphasise the importance of observations such as NEWS are an essential part of daily care, even for people who are expected to stay well.
We have ensured that there is a specialist team, the acute response team, who can act as a single point of contact for patients who are deteriorating day or night. One of our most important lessons is that families know their loved ones best, and because of that they can often be the ones who can recognise the signs of sepsis first.
With hindsight, her rising NEWS score, the increased pain, her family's concerns and Maddy's own belief that something just wasn't right were all red flags that she was becoming more unwell. Many hospitals in the NHS are introducing Martha's Rule, which allows patients and their relatives to directly ask for an urgent review from a dedicated team. For families, it's important to know that if you are worried, talk to your nurse or doctor. They want to support you and will never be upset about you raising your concerns. If things don't seem right, ask, could it be sepsis? Maddy was described by her friends as a shining light in their lives, and she brought laughter and joy to her close-knit family. Because of Maddy, healthcare staff are learning and improvements are being made.
We never want Maddy to be just a name or a number. We want you to see us, her parents, the human face. Our lives go on without our precious daughter, always carrying the pain of her absence. This never goes away.
If you are a healthcare provider and are interested in seeing the full training or using it within your own trust, please contact North Bristol NHS Trust and we will be happy to help.